The silent epidemic affecting millions worldwide isn't always visible in the mirror. Muscle loss might seem like just an aesthetic concern, but it's actually a key player in metabolic syndrome, a cluster of conditions that significantly increase your risk of heart disease, stroke, and type 2 diabetes. Metabolic syndrome affects roughly 1 in 3 adults globally. It's characterized by a combination of increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. What many people don't realize is how closely this syndrome is tied to the amount of muscle on your frame. Muscle tissue is metabolically active, meaning it burns calories even when you're at rest. When you lose muscle mass, your body's energy requirements decrease. This creates a cascade of metabolic changes that can lead directly to the components of metabolic syndrome. One of the primary connections between muscle loss and metabolic syndrome involves insulin sensitivity. Skeletal muscle is responsible for approximately 80% of insulin-mediated glucose disposal in your body. When muscle mass decreases, so does your body's ability to effectively clear glucose from the bloodstream, leading to insulin resistance and eventually elevated blood sugar levels. The relationship works both ways, creating a dangerous cycle. Insulin resistance itself can accelerate muscle loss by impairing protein synthesis, the process by which your body builds new muscle tissue. This creates a downward spiral, where muscle loss leads to worsening insulin resistance, which further accelerates muscle loss. As we age, we naturally lose muscle mass through a process called sarcopenia. Starting around age 30, most people lose 3 to 5% of their muscle mass each decade. This age-related muscle loss is a major contributor to the increased prevalence of metabolic syndrome in older adults. Inflammation plays another crucial role in this relationship. Muscle tissue produces myokines, anti-inflammatory compounds that help regulate metabolism. With less muscle, there's reduced production of these protective substances, leading to increased systemic inflammation that contributes to metabolic syndrome. Body composition changes associated with muscle loss also impact metabolic health. When muscle decreases, the ratio of fat to lean tissue increases, even if body weight remains stable. This shift toward higher body fat percentage, particularly visceral fat around the organs, is strongly associated with metabolic syndrome. Muscle tissue also influences lipid metabolism. With reduced muscle mass, there's decreased capacity for fatty acid oxidation, leading to elevated triglycerides and cholesterol abnormalities, characteristic of metabolic syndrome. The good news is that muscle loss isn't inevitable. Resistance training, adequate protein intake, and maintaining an active lifestyle can preserve and even build muscle mass at any age. These interventions directly target the physiological mechanisms linking muscle loss to metabolic syndrome. Maintaining healthy muscle mass throughout life is a powerful strategy for metabolic health. Beyond the visible benefits of strength and physical function, your muscles are active metabolic organs that help regulate blood sugar, lipid levels, and inflammation. Protecting this tissue is a fundamental aspect of preventing and managing metabolic syndrome and its serious health consequences.